My name is Jessica Roundy, and I am an MSW student and an assistant program director at Eagle Ranch Academy, Residential Treatment Center for At-Risk Youth. I am here to propose evidence-based reforms to Utah's drug policy. I am proposing a shift from policies developed from the moral model of addiction to policies based on the disease model of addiction. As a society, we have largely chosen to address drug use as a criminal offense. There are two main issues with this approach. First, addiction isn't a choice. People do not choose how their brains and bodies will respond to drug exposure. Addiction is a disease that changes the structure and function of the brain. These physiological changes can impair choice and willpower, making the decision to quit drugs far more difficult than the decision to start using drugs. Second, treating addiction like a crime is ineffective. This is evidenced by the outcomes of what is perhaps the most punitive approach to drug use to date, the war on drugs. The war on drugs has sought to decrease drug use and trade through increased criminalization, penalties, and enforcement for drug-related offenses. These policies have increased the national incarceration rate by 400% and increased the average sentence length for drug-related offenses by 153% since 1980. However, they have been unsuccessful in reducing drug use, with rates remaining at an all-time high. The exorbitant cost of imprisonment, coupled with a lack of evidence to support the efficacy of lengthier sentences, has led the Utah State Legislature to reform their drug use sentencing policies. Offenses once deemed felonies have been recently downgraded to misdemeanors. These changes have proven beneficial in reducing the prison population, reducing overall sentence length, and lessening the implications of criminal charges, such as the lifelong detriments of possessing a felony. An unintended consequence, however, that has arisen from decreased sentencing is a diminished opportunity for drug treatment. This is because treatment programs are often found in prisons, but not jails. While Utah State Prison has 3 well-established drug treatment programs, only 14 of the 26 county jails have drug treatment programs, of which vary in size and quality. This is cause for concern because an estimated 65% of the incarcerated population meets the criteria for at least one substance use disorder. This is in opposition to 5% of the general public. Drug treatment programs have been shown to significantly reduce the rates of relapse and recidivism in criminal offenders, yet those who could benefit from treatment rarely receive it while in the criminal justice system. Funding drug treatment programs both inside and outside of the criminal justice system can be a worthwhile investment that is more cost-efficient and effective at decreasing rates of relapse and recidivism than incarceration alone. Community-based drug treatment is even more cost-effective, having been shown to save taxpayers 3 times as much money as it costs to fund treatment programs within the criminal justice system. An example of a community-based treatment option is pre-booking diversion programs. Pre-booking diversion programs can provide those with nonviolent, low-level drug offenses an opportunity to receive treatment without obtaining a criminal record, which can prevent lifelong implications of stigma, loss of civil rights, difficulty obtaining jobs, housing, or welfare. Only a few counties in Utah have pre-booking diversion programs. Increasing the use of these programs could significantly reduce the incarceration rate and thus overall cost to taxpayers by diverting less serious offenders away from the criminal justice system and towards targeted treatment. For more serious offenders, the implementation of screening and treatment programs within jails can reduce relapse and recidivism rates among offenders and ultimately prevent repeat offenses and thus lessen tax expenditures over time. The funds saved from decreases in the prison population can be redirected towards funding these screening and treatment programs within jails. In conclusion, these policy proposals represent practical evidence-based solutions to drug policy that can improve the life quality and outcomes of those struggling with addiction, as well as decrease the cost to taxpayers in the short and long term. As such, I strongly urge you to consider these benefits while making decisions in future proceedings. Thank you for your time.